A new survey, in fact, most Americans are in favor of quarantining anyone who comes to the U.S. from West Africa. A CBS News poll shows 80% feel U.S. citizens and legal residents should be in isolation until it's certain they don't have Ebola. 17% are against the quarantine. The rest were undecided. Some nurses at UC Hospital say they aren't prepared for a possible Ebola outbreak.
They're especially upset because their facilities have been named the first choice treatment centers for any potential Ebola patient. CBS 2's Amber Lee is live at UCLA Ronald Reagan Medical Center with concerns from both nurses and hospital leaders. Amber?
Well, Rick, Sharon, that's right. About half a dozen registered nurses were out here this morning speaking out in hopes of getting their message across to hospital administrators. They held up signs like this saying protect registered nurses, and that's because they want more hands-on training and also full-body hazmat suits.
Ebola! Hazmat! Ebola! Hazmat!
These registered nurses at UCLA's Ronald Reagan Medical Center are speaking out about Ebola. They want the public to know they don't feel prepared to handle Ebola cases.
It's all new. Nobody understands everything completely. They're still developing the policies to address the protection for the staff and the public.
Christopher Jacks has been an RN for 12 years, and he just got off his 12-hour shift to join these nurses in today's Speak Out. He hopes by speaking out, it will raise awareness that more training and better equipment are needed.
It's very contagious, hard to contain if it gets out of hand, but basically I look at it as it's a public safety issue.
All 5 UC medical centers have been identified as priority hospitals to treat Ebola. Even though California has no reports of Ebola patients, the UC office says its facilities and staff are prepared. Early this month, UCLA Medical Center held its own Ebola preparedness exercise and says a small group of highly trained individuals have been prepared for a worst-case scenario. A statement released today by UCLA reads, "The safety and health of the patients we serve and all those who care for them is paramount in everything we do. Every day we add to our knowledge by staying in touch with other institutions and government agencies in order to optimize our readiness." These nurses tell a different story.
Training nurses, a group of nurses, one time doesn't make them competent.
They say only a handful of nurses have been Ebola trained, and they say more needs to be done.
You can't just have a few people doing it. It takes a massive group to support that.
These nurses are also asking for full-body hazmat suits that leave no skin exposed.
Not one more healthcare workers, not one more patient, not even the public should be put into risk with a facility not being prepared.
At 9 a.m. this morning, registered nurses met with hospital administrators in hopes of working something out. I've been trying to get a hold of these registered nurses. No one's been able to call me back, so it looks like they're still in that meeting with hospital staff. At UCLA, Amber Lee, CBS 2 News.